This is crucial information. If you are a veteran or if you care about a veteran, you know the stakes here are impossibly high. We are talking about life and death decisions, mental health lifelines, and the fundamental promise made to those who served our nation. When it comes to the Department of Veterans Affairs, the experience is often a massive, chaotic lottery. Some veterans receive world-class, life-changing care that truly honors their sacrifice. Others face agonizing wait times, bureaucratic nightmares, and sometimes outright neglect that makes seeking help feel worse than the injury itself. This video isn't about blaming individuals, it's about identifying systemic success and systemic failure, based on the aggregated, unfiltered experiences of thousands of veterans just like you. We've sifted through the data, the veteran satisfaction scores, the internal reports, and the personal accounts to bring you the definitive list. The 5 VA facilities that consistently fall short, and the 7 centers that are truly setting the standard for veteran care in America. Stick around, because knowing where the best resources are and where the danger zones lie could fundamentally change the trajectory of your health journey. We start now with the places veterans dread walking into, the facilities where the system seems to be actively working against the patient. We have to start this countdown with a location that has become, regrettably, synonymous with systemic failure: the Fallby, Phoenix VA healthcare system in Arizona. When we look at veteran dissatisfaction, Phoenix doesn't just rank low, it often sets the benchmark for how bad things can get when bureaucracy and lack of accountability collide. The core issue here, which has plagued the system for years and continues to linger despite promised reforms, is access, or rather, the deliberate obstruction of access. Veterans reported, and continue to report, absurdly long wait times, often stretching into months for crucial specialty care appointments. Imagine being a veteran dealing with chronic pain or a progressive condition, only to be told that the soonest you can see a specialist is 6 months out. This isn't just an inconvenience, it's a denial of timely care, which is the cornerstone of effective health care. The data shows that even post-scandal reforms, the internal culture of delay and obfuscation remains sticky. Primary care appointments, the gateway to all other services, are often booked solid, forcing veterans into urgent care, or worse, delaying necessary preventative screenings. We are talking about thousands of veterans who feel they must constantly fight the system just to get a basic checkup, let alone complex treatment. The anecdotal evidence is crushing. We hear stories of veterans showing up for appointments only to find they were canceled without notification, or being shuffled between 3 different doctors within a year, leading to a complete lack of continuity in their care. This constant turnover and lack of consistent oversight means that complex medical histories often get lost in translation, leading to misdiagnoses or missed opportunities for early intervention. For example, the difficulty in accessing specialized pain management programs here is particularly acute, pushing many veterans toward reliance on less effective or potentially harmful long-term medication strategies simply because the comprehensive, holistic options, like physical therapy or specialized psychological interventions, are too difficult to schedule. The sheer volume of veterans in the Phoenix area exacerbates the problem, placing an unsustainable strain on outdated infrastructure and understaffed departments. This isn't a funding issue alone. It is fundamentally a management failure where the focus shifts from patient well-being to simply processing paperwork, often at the expense of human life and dignity. The veterans we spoke to in Arizona expressed a profound sense of abandonment, feeling that the VA system, the one entity sworn to support them, had instead become their greatest adversary in the fight for health. This deep-seated frustration fuels distrust, making veterans less likely to seek care until their conditions become critical, perpetuating a vicious cycle of reactive rather than proactive healthcare delivery. The inability to secure timely mental health appointments is another critical flashpoint in Phoenix. an area where timely intervention is absolutely non-negotiable. Veterans struggling with post-traumatic stress or severe depression often face intake cues that are simply unacceptable, transforming a crisis into a catastrophe. When the system fails to provide that immediate support, the consequences can be devastating. This clinic's reputation is a stark warning about what happens when systemic issues are allowed to fester unchecked, and why veterans in this region often turn to private care, even if it means bearing significant financial burdens, simply to ensure they receive care before it is too late. The shadow of past failures looms large, and while leadership promises continue, the day-to-day reality for many veterans remains frustratingly difficult, cementing Phoenix's place at the top of the list for worst veteran experiences. We need to see fundamental cultural shifts here, not just cosmetic changes, if this facility is ever going to fulfill its mission. Moving east, our second facility that draws the ire of veterans is the Pardy, D.C. Veterans Affairs Medical Center. In the nation's capital, you might think that being so close to the centers of power, this facility would be a model of efficiency and excellence. The reality, however, is often the exact opposite. The DCVA often suffers from a unique brand of institutional paralysis, a perfect storm of high-level bureaucratic interference, constant turnover in key administrative roles, and an overwhelming focus on regulatory compliance over actual patient care. Veterans describe the experience here as navigating a labyrinth designed by someone who hates efficiency. Appointments are often scheduled and then immediately rescheduled or canceled, sometimes multiple times, leading to massive disruption and wasted travel time for veterans who often commute long distances into the city. The primary complaint here centers on the sheer complexity of getting referrals and managing prescription refills. Simple processes become monumental tasks, requiring multiple phone calls, endless hold music, and often intervention from outside advocacy groups just to get basic medical needs met. The facility itself, while undergoing renovations, has faced consistent complaints regarding infrastructure, cleanliness, and outdated equipment in certain wings, which contributes to a feeling of institutional neglect. This is particularly problematic in specialized areas like physical rehabilitation and prosthetic services, where state-of-the-art equipment is essential for optimal recovery. Veterans needing complex surgical procedures often report lengthy delays in pre-authorization and scheduling, suggesting a profound disconnect between the medical staff who recommend the treatment and the administrative staff who approve it. This bureaucratic friction slows everything down, adding unnecessary stress to already vulnerable patients. Furthermore, the D.C. area has a high concentration of veterans dealing with complex, service-connected disabilities, yet the specialized interdisciplinary teams needed to manage these multifaceted conditions often appear fragmented or under-resourced. The communication breakdown between departments is legendary, with the left hand rarely knowing what the right hand is doing. A veteran seeing a cardiologist might find that their primary care doctor hasn't received the notes, and the mental health provider is completely unaware of the physical treatment plan. This lack of holistic integration is a critical flaw. The DCVA experience highlights the danger of over-bureaucratization, where the system becomes so focused on internal metrics and political maneuvering that the actual patient, the veteran, gets completely lost in the shuffle. The emotional toll of constantly fighting the system is immense, and veterans in this area are often forced to become expert navigators of complex, hostile administrative processes just to survive. The frustration is palpable, and it stems from a feeling that, despite being at the center of the nation's political universe, the care provided here is often substandard, inefficient, and frankly insulting to those who have sacrificed so much. The challenge here is less about clinical skill, many of the doctors are highly qualified, and more about the organizational structure that prevents them from doing their jobs effectively, trapping high-quality providers in a low-functioning system. Our third entry on the list of facilities struggling the most is the Taos Loma Linda VA Medical Center in California. While California has several high-performing VA facilities, Loma Linda stands out, unfortunately, for its persistent issues related to capacity and specialty care access, especially for the massive veteran population in Southern California. The core problem here is overwhelming demand meeting insufficient resources, particularly in highly specialized fields like neurosurgery and advanced oncology. Veterans needing complex, cutting-edge treatment often find themselves stuck on incredibly long waiting lists or are pushed into the community care network, which, while sometimes beneficial, often lacks the integration and specialized knowledge that the VA's dedicated centers possess. The waiting game at Loma Linda is legendary, and it affects every level of service. Even routine lab work or diagnostic imaging can take significantly longer to schedule and process compared to national averages. This slow pace is particularly detrimental for veterans with aggressive illnesses, where time is literally measured in prognosis. The physical infrastructure also faces criticism. The facility often feels overcrowded and strained, leading to long waits in emergency departments and crowded common areas, which can be particularly stressful for veterans dealing with sensory sensitivities or PTSD. The veteran feedback consistently points to a significant lack of transparency in the scheduling and referral process. Veterans often feel they are given vague answers about their place in the queue or why a referral was denied or delayed. This lack of clear communication breeds anxiety and distrust, making an already stressful medical situation unbearable. One of the most common complaints revolves around the disconnect between the main hospital and the various community-based outpatient clinics, CBOCs, it oversees. The coordination between these satellite clinics and the central hub is often poor, meaning a veteran who starts care at a CBOC might find their records or treatment plan don't smoothly transfer to the main facility when specialty care is required. This institutional fragmentation forces veterans to repeat their stories, resubmit documentation, and essentially restart the process every time they transition between levels of care. Moreover, the sheer cost of living and the geographic spread of Southern California means that long wait times are compounded by difficult, expensive travel logistics for many veterans. When a veteran has to drive 2 hours for an appointment that is then delayed by 2 more hours, the systemic inefficiency becomes a major quality of life issue. The challenges at Loma Linda highlight the difficulty of providing high-quality, timely care in densely populated, high-demand areas without proportional investment in staffing and infrastructure expansion. The dedicated staff often feel overworked and burnt out, leading to inevitable drops in service quality, despite their best intentions. This facility needs a massive overhaul in its scheduling technology and a significant injection of resources to meet the overwhelming demand, ensuring that veterans are not left waiting endlessly for the critical care they have earned and desperately need. The inability to manage patient flow effectively is the single biggest retention killer here, driving veterans away and forcing them to seek alternatives, often leaving those with the most complex needs stranded in the bureaucratic morass. Our fourth facility facing significant criticism is the Memphis VA Medical Center in Tennessee. The issues here are slightly different, focusing heavily on infrastructure, consistency of primary care, and an alarming rate of staff retention problems, particularly among nurses and mid-level providers. Veterans in the Memphis region often report that the physical plan of the facility feels neglected and outdated, which, while seemingly cosmetic, significantly impacts the overall patient experience and confidence in the quality of care. The more serious concerns, however, center on the inconsistency of primary care assignments. It is common for veterans to have their primary care provider, PCP, change multiple times within a short period. This constant turnover makes establishing a trusting, long-term therapeutic relationship virtually impossible. For veterans managing multiple chronic conditions, having a consistent PCP who understands their history, their medications, and their personal context is vital. When that consistency is absent, care becomes disjointed, and the risk of medication errors or overlooked symptoms increases exponentially. The scheduling system here is also a major source of frustration. Veterans frequently report long hold times when trying to book appointments and a confusing triage system that often directs them to the wrong department, necessitating further delays. Furthermore, accessing specialized mental health services, particularly intensive outpatient programs, IOPs, for substance use disorder or severe PTSD, is often a protracted process. While the need is immense in this region, the availability of specialized slots is often insufficient, leading to dangerous gaps in care during critical periods. We've seen veteran testimonials detailing frustrating experiences with pharmacy services, including long lines, incorrect medication fills, and difficulty coordinating refills between the main facility and mail order. These seemingly minor logistical failures compound the stress of managing chronic illness. The systemic issue in Memphis appears to be a lack of robust internal systems to support staff, leading to high burnout and subsequent turnover. When staff feel unsupported, under-resourced, or overwhelmed, that stress inevitably trickles down to the patient experience. The veterans in this area deserve a facility that reflects the dignity of their service, not one that feels perpetually strained and struggling to keep up with basic operational demands. The core mission of the VA is to provide seamless, integrated care, and in Memphis, that integration often feels like a distant aspiration rather than a daily reality, particularly when dealing with complex, multi-systemic health issues that require coordinated effort across various specialties. Improving the veteran experience in Memphis requires not just new buildings, but a fundamental investment in staff support, competitive wages to reduce turnover, and a complete overhaul of the patient scheduling and navigation systems to ensure consistency and clarity. Finally, rounding out our list of the 5 facilities that veterans consistently rate as the most challenging is the Manchester VA Medical Center in New Hampshire. The issues here highlight the unique challenges of providing comprehensive care in smaller, more geographically isolated regions, but the severity of the specific problems warrants its inclusion. Manchester has faced significant public scrutiny in recent years, particularly regarding the quality of its primary care and the management of internal investigations. The primary concern that remains stubbornly persistent is the perceived lack of accountability and transparency when issues arise. Veterans often feel that when they raise a complaint about substandard care or administrative errors, their concerns are minimized, dismissed, or simply vanish into a bureaucratic void. This lack of responsiveness creates a deep sense of cynicism and distrust, making veterans hesitant to engage with the system at all. Clinically, the most pressing issues in Manchester revolve around diagnostic capacity and specialized surgical services. Veterans frequently report that complex diagnostic workups are often delayed or that they are forced to travel significant distances to Boston or other major metropolitan areas for procedures that should ideally be managed closer to home. While using community care is an option, the coordination and authorization process often proves cumbersome, creating significant logistical hurdles for older or less mobile veterans. However, the most profound failing consistently reported here is in the mental health services provided. Veterans dealing with serious mental health conditions, including severe depression, psychosis, and complex PTSD, have reported long waits for initial assessments and a perceived shortage of highly specialized trauma-informed therapists. The availability of intensive, residential, or partial hospitalization programs is often critically low, forcing veterans into less optimal outpatient settings when a higher level of care is medically necessary. This shortage of specialized mental health resources is a critical safety issue, particularly in a region with a high rate of veteran suicide attempts and ideation. The veterans of New Hampshire deserve immediate access to high-quality, comprehensive mental health care, and the Manchester facility has historically struggled to meet this demand effectively. The combination of historical organizational issues, a perceived culture of defensiveness, and critical gaps in specialty care, especially mental health, solidifies Manchester's position as one of the most difficult facilities to navigate and receive consistent, high-quality care, reinforcing the narrative that geographic isolation should never equate to substandard healthcare delivery. These 5 facilities, Phoenix, D.C., Loma Linda, Memphis, and Manchester, represent the systemic friction points within the VA, showing us where efficiency, accountability, and timely access to care are most critically lacking. Now, let's take a collective deep breath and shift our focus entirely. While the challenges are real and serious, it is absolutely essential to recognize that the VA system also contains shining examples of excellence, innovation, and profound dedication. These are the facilities that veterans praise, the centers that have managed to overcome bureaucratic hurdles, prioritize patient experience, and deliver care that truly honors the commitment made to our service members. These facilities are not perfect, no healthcare system is, but they consistently demonstrate superior performance in key areas like efficiency, staff retention, specialized programs, and overall veteran satisfaction. If you live near one of these 7 locations, you are likely benefiting from some of the best care available anywhere in the nation. Our first shining example is the VA Palo Alto Healthcare System in California. Palo Alto is often cited as a model for the entire VA network, and for good reason. What sets this facility apart is its deep integration with world-class academic research and its commitment to innovation, particularly in areas like prosthetics, spinal cord injury rehabilitation, and mental health technology. This isn't just a hospital, it's a major research hub, meaning veterans here often have access to cutting-edge treatments, clinical trials, and specialized expertise long before they become standard practice elsewhere. The veteran experience at Palo Alto is characterized by efficiency and coordination. Unlike the fragmented systems we discussed earlier, Palo Alto excels at multidisciplinary care. If a veteran is dealing with a complex issue, say a combination of physical trauma, chronic pain, and PTSD, their entire care team, including physical therapists, psychologists, and specialists, operates in concert, communicating seamlessly to develop a cohesive treatment plan. This holistic, integrated approach drastically improves outcomes and reduces the burden on the veteran to constantly coordinate their own care. Wait times for specialty consults are generally lower than national averages, and the facility utilizes advanced technology for scheduling and patient communication, minimizing the frustrating phone tag and paperwork delays common elsewhere. Furthermore, Palo Alto has invested heavily in specialized mental health programs, including dedicated centers for trauma recovery and sophisticated programs utilizing virtual reality and biofeedback to treat anxiety and PTSD. The facility culture is one of professionalism, respect, and continuous improvement. Staff retention rates are high, which means veterans benefit from consistent, long-term relationships with their providers, a critical factor in managing chronic and complex conditions. The dedication to pushing the boundaries of medical science while maintaining a veteran-centric focus makes Palo Alto a true leader and a benchmark for what VA care should aspire to be. The commitment to technology integration extends to telehealth, making it easier for veterans in remote parts of Northern California to access specialized consultations without the need for extensive travel, demonstrating a forward-thinking approach to access and delivery. Next on our list of exemplary facilities is the Milwaukee, Minneapolis VA Healthcare System in Minnesota. Minneapolis consistently receives high marks for its operational efficiency, its robust mental health offerings, and its exceptional patient satisfaction scores. The key to their success seems to be a relentless focus on minimizing bottlenecks and maximizing throughput without sacrificing quality. Veterans here report that the scheduling process is remarkably smooth and transparent. Primary care appointments are generally available quickly, and the facility has implemented highly effective systems to track referrals, ensuring that veterans don't fall through the cracks waiting for specialty authorization. The Minneapolis VA is particularly renowned for its mental health services. They offer a comprehensive suite of programs, including specialized treatment for military sexual trauma, MST, substance use disorder, and robust residential programs for severe PTSD. The staff is consistently described as compassionate, highly skilled, and deeply committed to trauma-informed care, a critical distinction that makes a massive difference in patient engagement and outcomes. Unlike facilities where mental health services feel like an afterthought, Minneapolis places them front and center, recognizing their fundamental importance to overall veteran well-being. Furthermore, the facility shines in its handling of polytrauma and rehabilitation, boasting modern facilities and highly trained specialists dedicated to helping veterans recover from complex physical injuries. The culture of respect extends beyond the clinical staff. Veterans frequently commend the administrative and support staff for their helpfulness and professionalism, indicating a strong, positive organizational culture from top to bottom. The low rate of veteran complaints and the high marks on patient surveys are tangible evidence that Minneapolis has cracked the code on efficient, compassionate, and high-quality integrated healthcare delivery. They prove that high-volume centers can still provide personalized, attentive care by prioritizing streamlined processes and investing in staff well-being and training. Their dedication to proactive outreach and preventative care programs also sets them apart, ensuring veterans are engaged in managing their health before crises occur. Our third top-performing facility is the Ralph H. Johnson VA Medical Center in Charleston, South Carolina. Charleston is a fantastic example of a facility that successfully balances high-quality specialized care with an intimate, community-focused approach. Veterans often describe the care here as personalized and deeply attentive, feeling more like a private medical practice than a large government institution. The major highlight of the Charleston VA is its exceptional primary care model and its specialized services for Gulf War illness and other environmental exposures. The facility has dedicated teams focused on researching and treating these complex conditions, providing veterans with access to expertise that is hard to find elsewhere. Staff retention is strong, allowing veterans to build long-term relationships with their primary care teams, which is crucial for managing chronic conditions effectively. Veterans consistently praise the ease of communication with their providers, often noting that messages are returned promptly and concerns are addressed swiftly, a sharp contrast to the communication black holes experienced at the EASA's worst-performing facilities. The Charleston facility also excels in its transparency regarding wait times and scheduling. They manage veteran expectations effectively and minimize unnecessary delays, leading to high levels of trust. Furthermore, the facility has strong community partnerships, ensuring that veterans who need services outside the VA network, such as specialized housing or vocational rehabilitation, are smoothly connected to the appropriate resources. This comprehensive approach, looking beyond just the clinical need to the veteran's overall quality of life, is a hallmark of truly exceptional care. The atmosphere at the Charleston VA is frequently described as welcoming and supportive, fostering an environment where veterans feel comfortable seeking help, particularly for sensitive issues like mental health. Their success lies in treating the veteran not just as a patient, but as a valued member of the community, ensuring that the care provided is both clinically excellent and deeply human. Next, we travel to the mountains for our fourth top facility, the Bar George E. Wallen VA Medical Center in Salt Lake City, Utah. Salt Lake City stands out for its progressive and highly effective approach to pain management and holistic care. In an era where opioid misuse remains a major concern, the Salt Lake City VA has pioneered innovative, non-pharmacological methods for treating chronic pain, focusing on integrated therapies like physical therapy, chiropractic care, acupuncture, and specialized psychological interventions. Veterans here report significant success in managing chronic pain without relying solely on heavy medication, leading to better long-term functional outcomes and improved quality of life. The facility's commitment to holistic health extends to its mental health programs, which are highly rated for their incorporation of recreational therapy and peer support specialists. The integration of veterans who have successfully navigated the system to help mentor and guide those currently struggling is a powerful asset that fosters connection and hope. Operationally, the Salt Lake City VA is known for its efficiency and its excellent coordination with the vast network of CBOCs across Utah, Wyoming, and Idaho. This is critical for reaching veterans in remote rural areas. The facility utilizes advanced telehealth and remote monitoring capabilities to ensure that distance does not become a barrier to high-quality care, setting a gold standard for rural healthcare delivery within the VA system. Veterans praise the responsiveness of the telehealth teams and the quality of the remote consultations. Furthermore, the facility boasts strong geriatric and extended care programs, recognizing the unique and increasing needs of the aging veteran population. The emphasis on preventative care and wellness programs, including robust nutrition and exercise counseling, contributes to the overall high satisfaction scores. Salt Lake City demonstrates that a regional hub can effectively manage a massive, dispersed population by leveraging technology and focusing heavily on specialized, integrated programs that address the root causes of veteran health issues, rather than just treating the symptoms. Our fifth facility earning high marks is the Hodge James A. Haley Veterans Hospital in Tampa, Florida. Tampa is a globally recognized leader, particularly in the treatment of polytrauma, traumatic brain injury, TBI, and advanced rehabilitation. Due to its location and specialized units, it often serves veterans with the most severe and complex injuries sustained in recent conflicts. What makes Tampa exceptional is the sheer depth of expertise and the specialized resources dedicated to rehabilitation and recovery. The facility operates state-of-the-art rehabilitation centers, utilizing cutting-edge technologies and highly specialized staff, including occupational therapists, speech pathologists, and physiatrists, who are experts in complex recovery protocols. Veterans and their families consistently laud the compassionate, comprehensive, and long-term approach to care. Rehabilitation here isn't a short-term fix. It's a sustained, multi-year commitment to helping the veteran achieve the maximum possible level of function and independence. The facility also excels in mental health services tailored specifically for TBI and polytrauma patients, recognizing the critical intersection between physical injury and psychological trauma. The interdisciplinary teams work together seamlessly, ensuring that physical recovery and mental healing are addressed simultaneously. Tampa also receives high marks for its proactive approach to family and caregiver support, offering resources and education that recognize the critical role loved ones play in the veteran's recovery journey. The sheer volume of complex cases handled here means the staff possesses an unparalleled level of experience, leading to better diagnostic accuracy and more effective treatment plans. For veterans dealing with catastrophic injuries, the Tampa VA represents the pinnacle of specialized care within the VA system, offering hope and tangible progress where other facilities might struggle with the complexity of the cases. Their commitment to continuous innovation in prosthetic and orthopedic care further cements their reputation as a national leader. Moving to the heartland, our sixth exceptional facility is the HOT VA North Texas Healthcare System in Dallas, Texas. Dallas stands out for its massive scale, yet it manages to maintain exceptional quality across a broad spectrum of specialty services, making it a crucial regional asset. The success of the Dallas VA is rooted in its efficient management of high patient volume and its robust offering of specialty clinics, particularly in areas like cardiology, oncology, and women's health. Veterans consistently report that accessing specialized care is significantly easier and faster here compared to many other large metropolitan VAs. The facility has invested heavily in technology to streamline patient flow, reducing administrative burdens and allowing clinical staff to focus more time on direct patient interaction. The Women's Health Program in Dallas is frequently cited as a national best practice, offering comprehensive, gender-specific care in a supportive and dedicated environment, addressing a critical need that is often overlooked or poorly integrated in other facilities. Furthermore, the Dallas VA boasts strong affiliations with major medical schools, ensuring a steady influx of high-caliber medical talent and access to the latest academic research and techniques. The facility culture emphasizes accountability and patient feedback. Veteran concerns are generally addressed quickly and thoroughly, fostering a high degree of trust in the administration. The sheer breadth of services available under one roof, from complex surgery to advanced diagnostic imaging, means veterans rarely need to rely on external community care, ensuring continuity and integration of their treatment plans. For veterans in a massive region like Texas, the Dallas VA serves as a reliable, high-performing medical anchor, providing sophisticated specialty care with remarkable efficiency and patient focus, proving that large-scale operations can indeed deliver personalized, high-quality outcomes. Finally, our seventh and last facility recognized for excellence is the White River Junction VA Medical Center in Vermont. While smaller than the massive hubs like Palo Alto or Dallas, White River Junction is a standout model for providing exceptional, community-integrated care in a rural setting. Its success is defined by its deep commitment to personalized medicine and its pioneering use of telehealth and community outreach to reach veterans scattered across Vermont and New Hampshire. The veteran experience here is consistently described as warm, personal, and highly responsive. Staff-to-patient ratios are often favorable, allowing providers to spend more time with each veteran, fostering stronger therapeutic relationships. White River Junction excels in geriatric care and mental health services, particularly for aging veterans dealing with isolation and chronic conditions. They have developed highly successful home-based primary care programs, bringing medical services directly to the homes of veterans who are unable to travel, which is a game-changer in rural health care. Their mental health programs focus heavily on peer support and community integration, recognizing that recovery often depends on social connection as much as clinical treatment. The facility maintains excellent coordination with local community providers, ensuring seamless continuity of care when external services are needed. The low staff turnover rate speaks volumes about the positive organizational culture, which translates directly into consistent, high-quality care for the veterans. White River Junction proves that size is not the measure of quality. Rather, it is the dedication to personalized service, community connection, and innovative outreach that truly defines excellence in veteran care. This center is a testament to the power of a focused, veteran-centric mission executed by a dedicated, stable team. So, what have we learned from comparing the 5 most challenging facilities with the 7 best models? The disparity is stark, but the lessons are clear. The worst facilities, Phoenix, D.C., Loma Linda, Memphis, and Manchester, suffer from chronic issues related to administrative friction, lack of accountability, staff turnover, and critical bottlenecks in specialty and mental health access. Their core failure is often organizational, the inability to coordinate care and streamline processes, turning simple medical needs into complex bureaucratic battles. Veterans in these areas often feel unseen, unheard, and actively obstructed in their pursuit of health. The common thread is delay and fragmentation. Conversely, the best facilities, Palo Alto, Minneapolis, Charleston, Salt Lake City, Tampa, Dallas, and White River Junction, succeed by prioritizing efficiency, investing heavily in specialized programs, especially mental health and rehabilitation, fostering strong staff retention, and embracing technology to enhance access and coordination. Their success is rooted in a culture of accountability, transparency, and a relentless focus on the veteran as a whole person, not just a set of symptoms. They don't just treat conditions, they manage complex lives. The difference between a high-retention VA and a high-turnover VA often boils down to this: seamless, integrated care versus fragmented, confusing bureaucracy. Your health, your recovery, and your peace of mind should not depend on a geographical lottery. Veterans deserve the gold standard of care consistently, everywhere. If you are struggling at one of the facilities we highlighted as challenging, remember that you have options, including utilizing the Community Care Program, and you have the right to demand better service and accountability. If you are fortunate enough to be served by one of the top 7, use those resources fully. The fight for consistent quality VA care continues, and by sharing our experiences and demanding excellence, we can push the entire system toward the standard set by these true leaders. Never stop advocating for the care you earned. Share your experiences in the comments below. Which VA system has been your lifeline, and which one has let you down? Your input helps guide others,